Dozens of drugs deemed critical for fighting the coronavirus are in short supply, and that's in part because of an increase in demand. But CBS News also found potential problems in the global supply chain. Our consumer investigative correspondent, that's Anna Werner, shows us how the shortage is also affecting antibiotics and prescription drugs. Anna, good morning to you.
Good morning, Gayle. That's right. Some people who do not have COVID-19 are now dealing with shortages, like one young woman in San Antonio, Texas.
Not being able to breathe is the most stressful thing in the world.
Meet 18-year-old Ava Valdez. She's a student who needs an inhaler for allergy-induced asthma.
An allergy pill and this contraption.
But due to COVID-19, supplies of albuterol inhalers are running short, so she's rationing her use.
To have to wake up every morning and say, okay, can I use this thing that I desperately need and that will provide me immediate relief is really frustrating to not know whether or not I can have that.
At least one inhaler manufacturer, GlaxoSmithKline, says it has ramped up production of inhalers to meet increased demand. But a list put together by the Resilient Drug Supply Project at the University of Minnesota shows of 40 drugs deemed critical for treatment of COVID-19 patients, 80% are in short supply. U of M professor Stephen Schondelmeyer.
Some are drugs that we call paralytics that they might use when they put you on a ventilator. And then some drugs as plain and common as acetaminophen, the active ingredient in Tylenol.
Data from healthcare services company Vizient shows demand for 3 classes of drugs needed for patients on ventilators was 87% higher in April than in January, and just 57% of orders placed by its member hospitals could be filled. And it's not just drugs for COVID-19 treatment. Schondelmeyer tracks shortages on many critical care drugs, from anesthetics to painkillers.
We've had drugs on the shortage list for more than 2 decades. COVID-19 has kind of brought this to light.
One factor, the international supply chain for pharmaceuticals often leads to China, says author Rosemary Gibson, who wrote the book China RX.
China has a dominant global market share for so many of the core chemicals and ingredients.
For example, take antibiotics. A Congressional Research Service report found the U.S. gets 52% of its penicillin and 90% of its tetracycline from China. China also manufactures chemicals known as active pharmaceutical ingredients, or APIs, key ingredients in drugs.
When I say China, controls our supply of medicines and dominates the world's supply, it's not the finished pills that we take, but it's the core ingredients, the chemicals to make them. We'll be standing in line with other countries, scrambling to find critical medicines, just as we are for masks and other protective gear.
In March, the NIH's Dr. Anthony Fauci told members of the House Appropriations Subcommittee that health experts have been looking at the supply chain issue since 2005.
Something like 90% of the fundamental ingredients that go into many of the drugs, not the actual drug itself, comes from China. So that is a real problem.
Subcommittee Chair Representative Rosa DeLauro says it's time to address it.
The fact of the matter is that with regard to drugs, generics, that whole supply chain is really where we're very, very dependent on China. And that's got to change.
Drug manufacturers say they're working to prevent shortages, but there are a number of complex factors here. The group that represents drug companies says its members make significant investments in making sure that people have access to their brand-named medicines. Gayle?
All right, Anna, thank you very much. Good information there.